Okay. So good evening, postgraduates, and my regards to all the mentors who have logged in. Well, welcome to this Pan-India Intercollegiate Quiz, which is hosted by Brain Teasers in association with Ophthalmological Society of Nagpur, the Big Q. Well, you are all familiar figures spoken by
मैं कुछ
Saudi
जीतना ही
Arabia,
नहीं।
which you might be hearing since last 12 episodes.
छोड़ छाड़ के सारे छप्पर हट समंदर अपना अंबर खोज ले अब तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल दे पर खोल दे पर खोल दे पर
So once more, good evening, friends, and my pranam to all the mentors. Brain Teaser team welcomes you to the second semi-final of the fifth season of Big Q. Well, people who are not aware and who are novice to this platform, Brain Teaser is an online platform for hosting quiz for ophthalmologists of our country since last 6 seasons or other years. It was 4 years back when we thought of getting all the postgraduates on a single platform, and that is how the Big Q evolved. There are approximately 320 institutions which are offering post-graduations in ophthalmology, be it in the form of MS or DNB. This season, we had almost 250 plus teams who participated, and my sincere most thanks to all the teams and the mentors who participated and played with us. We have been hosting this particular program in association with Ophthalmological Society of Nagpur, and we are really thankful to the president, Dr. Shamika Mokadam, for associating with Big Q even in this fifth season, I should say, for the third time. Well, friends, in this fifth season, we had 6 preliminary rounds, 4 quarterfinals, 2 semi-finals, and today is the second semi-finals. And 2 weeks down the line, we'll be having the finals. These episodes were aired on alternate Wednesdays at 7:30 p.m. Brain Teaser is extremely thankful to the team of quiz masters who really toil hard behind the scene and create a wonderful experience of learning with fun. Today's quiz master, we have Dr. Santosh Honavar, a well-known name. He is also a secretary of All India Ophthalmological Society. He is a director of ophthalmic plastic surgery and ocular oncology at Center for Sight, Hyderabad. And he is also an avid quiz master, which you must have met him as a quiz master at various other platforms as well. Welcome, Dr. Santosh, sir.
Thank you, Prashant.
The second quiz master for today is Dr. Akshay Nair, who is again an oculoplastic surgeon at Dr. Agrawal's Eye Hospital, Mumbai. He is an avid quiz master and a big researcher with lot of publications to his name, and probably in short duration, he will be the most sought after scientist from our country in the field of ophthalmology. Thank you, Akshay, once more for being with us for this second or third season in a row. Thank you. And of course, the third quiz master is Dr. Shilpi Narnore, who is currently head vitreoretinal services and ROP specialist at Sarakshi Netralaya, Nagpur. She also is a co-host of Big Q since last few seasons. Well, no mega projects are possible without a strong financial backing, and we are extremely thankful to His Highness for partnering with us for this second season as well. My gratitude goes to Mr. Suryanarayanan, Mr. Naresh Rautela, and Mr. Kostu for their support in this second season as well. I would fail in my duties if I don't acknowledge the field force of His Highness, who made so much of efforts to enroll all the postgraduates from almost 250 institutes from across the country. Thank you, Team Highness. Smooth and flawless execution of any online platform, be it in the form of registrations, live quizzing, computing results, and lot many backend works goes behind every episode. And this was possible only because of Numeratech team headed by Mr. Sai. I'm extremely thankful to Sai and his Numeratech team who have been associated with us since last 6 seasons. So now, without much ado, I would request my co-host, Dr. Shilpi, to take you through with the rules of the game for this semi-final two.
Thank you, sir. So, welcome all the postgraduates and teachers and all the mentors. So, today is our second semi-final, and our final will be on 20th of May at same time, that is 7:30 p.m. So, for teams, you have to log in through two platforms. That is one for the Kahoot and other is the Zoom platform. First screen is the live quizzing on the Zoom platform. Out of the 3 rounds, 2 will be on Zoom platforms and will be face to face with the quiz master. And this will be only for the teams. While the second screen is the Kahoot platform for the MCQ round for both the audience and the teams. I request all the mentors to log in from separate screen only on the Zoom platform. Out of the 10 teams who are playing today's semi-final, 5 teams will qualify for the finals, and the criteria is the respective semi-final marks. That is, today's marks will decide which teams will qualify for the finals. Now, coming to the rules and the format of the quiz, we'll have 3 sets of MCQs, and each set will have 5 questions which have to be played by both the audience and the teams. There is no negative marking in this round, and you will get 10 seconds per question to answer. The second round is a rapid fire round only for the teams. In this, you will need to answer 5 questions in 40 seconds time. For every correct answer, plus 10 will be given, while for the every incorrect answer, minus 5 will be deducted. We request all the teams that if you don't know the answer, say pass so that we can display the next question and you can go through all the 5 questions. The third round will be image or the case-based round, again only for the teams. In this, one image will be shown and then 3 questions related to that image will be asked, and you need to answer those 3 questions in 20 seconds time. Again, for every correct response, plus 10 marks, while for incorrect, minus 5 will be deducted. Teams who are not playing today's semi-final, you can play as an audience in private practitioner category, but remember to write PP in front of your mobile number so we can recognize you in the private practitioner category. These are the prizes for the postgraduates in the finals, while for the audience, we have prizes per episode. So with this, we start with our first round of the MCQ. The first MCQ is pick the odd one out. Option A, tropicamide. Option B, atropine. Option C, letanoprost. And option D, timolol. And your time starts now. Time is up, and let's see what is the correct answer. The correct answer is option B, atropine. Why? Because it is the only drug which is derived from the natural source. Rest all are synthetic. The next question is, which of the following drugs is obtained from Streptococcus orientalis? The options are A, cyclosporin, B, penicillin, C, vancomycin, and D, tacrolimus. And your time starts now. Time is up. And the correct answer is C, vancomycin. It is derived from the Streptococcus orientalis, while the cyclosporin is derived from a fungus, penicillin again from a fungus, and tacrolimus from a bacterium, that is Streptomycin succubensis. The third question is, in idiopathic intracranial hypertension, intake of which of the following drugs can cause a causal effect? A, ACE inhibitor group of antihypertensives. B, carbonic anhydrase inhibitors. C. Tetracycline group of antibiotics. And D. Bronchodilators. And the time starts now. So let's see what is the correct answer. It is C, that is tetracycline group of antibiotics which have been implicated as a cause of IAH. The fourth question is the standard deviation is extremely useful in judging the representativeness of the option A, dispersion, option B, mean, option C, skewness, and option D is kurtosis. And your time starts now. So answer is B, that is standard deviation is useful in representativeness of the mean, which is the dispersion or spread of the data points around the average. Now coming to the last question of the first set of MCQs, how many ganglion cell loss should be there before visual field defects become manifest on white perimetry? Option A, 5 to 10%. Option B, 25 to 30%. Option C, 50 to 60%. And option D, 2 to 3%. And the time starts now. So the correct answer is option B, that is 25 to 30%. With this, we end with the first round of MCQ round. And now it's time for the second round, that is the case-based questions. For this, I invite Dr. Santosh sir on the screen.
Yeah, thank you, Shilpi. Now they'll all come online and then they'll choose the set, is it?
Yes, sir. Yes, sir. They will choose the sets.
Okay.
So
Which team would go first?
yes, sir. So first team is team 5, that is BMC3. Please switch on your audio and video.
BMC, my college.
Good evening, sir.
Good evening, sir. Good evening.
So please introduce yourself. Hey, team.
Ma-
Sorry. Team 5. Can you please introduce?
Myself, Dr. Adesh Munda.
I'm Dr. Ajay Mahore from BMC Sagar.
Conduct.
Okay. So which case
BMC
you want?
Sagar, okay. Yeah, which set?
Which set?
7.
Set 7.
Okay.
Okay.
All right. So this is a picture that you see on the screen. Can we have the text also of the picture?
BPS syndrome.
What is the component of the blepharophimosis syndrome? That's the first question. Component you have to say.
Ptosis or epicanthus inversus.
Okay, then. How is telecanthus defined?
Increased distance between two canthus.
Third question. Anyway, then, what is the mutation that is implicated? These three were the questions. Components of blepharophimosis, of course, as you rightly said, bilateral ptosis and epicanthus inversus and telecanthus. That is also a component, right? That you probably did not mention. How is telecanthus defined? Telecanthus is defined as increased intermedial canthal distance more than half of interpupillary distance. That is the definition of telecanthus. Can we have the answers? And the mutation, of course, you're supposed to know. That is FOXL2 gene on 3q23. That is the mutation. So I think you got one answer correctly here. Components of blepharophimosis syndrome. So we'll give that to you. How many points do they score, Shilpi, for this?
10. So, but what about the second? Do we?
Second one, they did not define it.
So it's 0, not
Zero,
negative
zero,
also. No?
not
Okay.
negative.
Okay. So plus 10 from this round, sir.
Okay.
Thank you, sir.
Okay.
So the next team is team 3.
AIMS Raipur. Arushi and Aisha, can you choose your set?
Retinuts, team retinuts. Team retinuts, are you there? Okay. Sai, can you please check with them? Meanwhile, yes. So the next team is Team 7, that is Cure Curiosity.
They're from Government Hospital, Madurai. Yeah. Team Curiosity. Nisapni and Nivita.
Good evening, sir.
Good evening. Which set do you want?
Set number 5, sir.
Set number 5. Is that your lucky number?
Yes, sir.
Yes. Right. So you see a 22-year-old girl with mild acquired ptosis of the left eye. And you also see an instrument. Okay. The questions will follow. Can I have the questions now? Yeah. What classic baseline drug test would decide the surgical options?
Pass.
Pass. Okay. Second question. What is the name of the classic instruments used for mullerectomy? Third question. What is the calculation for Fassner's procedure?
Pass, sir.
Pass.
Okay.
All right. Answers. The baseline test that is used is phenylephrine test to decide whether you can do mullerectomy or not. Right? Even if phenylephrine test is negative, you can still do mullerectomy, but that's the classic test that is described. Name of the classic instrument used for mullerectomy is Potamann's clamp, and the calculation for Fassner's procedure is 2 millimeter of tarsoconjunctival excision for every 1 millimeter of ptosis.
Okay.
Next, please. Go back to the team. Yeah.
So Team 1, that is Fovea Finders from GMC Nagpur.
GMC Nagpur. Darpita Pandey and Richa Verma.
Good morning. Good evening, sir.
Good evening.
Which set?
Set 9.
Set 9. 9 for Nagpur.
Yes, sir.
Okay. So you see a CT scan here, which is contrast enhanced CT scan. 54-year-old male with left eye proptosis and redness in the eye for 3 months. And that is the CT picture that you see. Okay, this is a contrast enhanced CT scan. Can we have the questions? What is the abnormality that you see in the left orbit? Quickly. If you don't know, you can pass.
I think they said pass, they're on mute.
What can be the differential diagnosis?
Thyroiditis, optic nerve phenomena.
Wrong. Third question. Anyway, you did not answer that.
Yes.
What ophthalmic signs do you expect in this condition? So the answer is that that's a dilated superior ophthalmic vein with contrast enhancement. Okay, so whenever there is a dilated superior ophthalmic vein with contrast enhancement, you suspect in a red eye condition with elevated intraocular pressure, with or without head trauma, you suspect keratico-cavernous fistula or dural cavernous fistula. And which ophthalmic sign do you expect in this condition? Pulsatile proptosis, thrill, and bruit. These are the three signs and symptoms, signs that you expect.
So a 0 to them from this round, sir.
Yeah.
Team Retinates, are you there?
They are restarting the machine, madam. We can go to the next team.
Okay. So the next team is Team 10, that is Oro Serata from Arvind Eye Hospital, Coimbatore.
Nice name and a great mentor. Kasturi and
Thank you,
Manisha.
sir. Good evening, sir.
Good evening.
Which set?
So set 6.
Set 6.
Okay. This is an 80-year-old male with lax upper eyelid skin and hooding. Right? So questions will follow.
Yes, sir.
Yeah. Questions? What is the diagnosis?
Associated obstructive. Floppy eyelid syndrome.
Next question. Define tarsal platform show.
So next question. Pass first.
Next question. Define bro fat span.
Pass.
Okay. So this baggy eyelid or a thin skin with over kind of a lid crease being overhung by that excess skin is called dermatochalasis. Tarsal platform show is defined as the distance of the upper eyelid margin to the upper eyelid crease in primary position in pupillary axis. How much of the epitarsal tissue is visible? Define the brow fat span, that is the distance of the lower edge of the eyebrow and the upper eyelid crease in primary position in pupillary axis. All right.
So -5 to them for
Minus.
the wrong answer. of the
Wrong
first one. Yes. The next team is team 2, that is binocular bandits from Kasturba Medical College, Mangalore.
Prerna and Raghuveer. Hi. What is the set? You have to unmute yourself first.
Hello.
Good evening, sir.
Good evening, sir.
Hi.
Set 4, sir.
Set 4.
Set 4.
Okay. Same patient, 2 pictures. One with retroillumination and the other is without. A 30-year-old lady with right eye ptosis, acquired ptosis. All right. Questions will follow. Questions, please. What is the diagnosis?
Anisocoria. Pass, sir. Next question.
Next question. Name 2 topical drugs that can be used to diagnose this condition.
Sir, pilocarpine we can use,
Okay.
and anisocoria. So this is pilocarpine. So next question. Name 3 features.
Name 3 features.
Anisocoria with ptosis.
Okay.
Anisocoria,
Don't-
ptosis, and proptosis.
Okay.
Yeah, so you're partially right.
Okay,
Can we
this
have the
one is
answers,
good.
please?
Yes.
No, the answer is not anisocoria. Answer is Horner syndrome. Topical drugs that are used are, of course, you said pilocarpine. So 1 you have answered. That's fine. Name 3 features. You did not completely mention everything: ptosis, anhidrosis, meiosis, enophthalmos, and anisocoria. So we can give you 10 points for this because you have partly answered questions 2 and 3.
So total 10 or 10 and
Total 10.
total 10. Okay, sir. Okay.
Thanks, sir.
Okay, so we are done with 5 sets of rapid fire round.
5 sets of
Sorry, case based. So now it's time for us. Acha, next team is team 9. Team Netra from Chaitanya Eye Hospital and Research Institute, Trivandrum. So now I invite Dr. Akshay Nair for the rapid fire set.
Okay. All right. Just give me 1 second. Open this here.
So we can't hear you properly.
Can you hear me now?
Yes.
Yeah, okay.
Team from Chaitanya Eye Hospital.
Yes, ma'am. Good evening, ma'am.
Good evening. So please introduce yourself.
Myself, Dr. Anjana. I'm a 3rd-year resident. Myself, Dr. Parvati, 3rd-year resident.
All right. So which is your set?
Set 2, sir.
Set.
2.
Your voice is not very clear to us.
Ma'am, now is it clear?
No, it's echoing.
There's a
Akshay
lag.
sir, is it clear to you?
No, there is a little
Echo.
cracking. Yeah.
Yeah.
Maybe you want to turn your video off and just keep the audio on, so that may help.
Okay, sir.
Okay.
Now is it clear, ma'am?
Yes. Okay. So shall we start?
Yes, ma'am.
We'll take only the first heard answer as the correct answer. All right. True or false? Choroidal melanoma most commonly metastasizes to the liver.
True.
Is correct. Inheritance pattern of Leber hereditary optic neuropathy
Mitochondrial.
is correct. Expand the procedure SMILE.
Small incision lenticule extraction.
Is correct. What is the name given to the iris lesions associated with NF type 1?
Leash nodules.
Is correct. Which is the drug most commonly associated with floppy irid syndrome?
Tamsulosin.
Is correct. With a second on the clock, you've got all 5 correct.
Wow.
Great.
All right. Great performance by
Team
team
Netra from Chaitanya.
Trivandrum.
Yeah.
Thank you, sir.
So the next team is Team 4, that is BMC 1 from Bundelkhand Medical College, Sagar.
Excellent. So BMC 1, what set are you choosing?
Set 9.
Okay. Set 9.
All right. Got it. Okay.
Shall we start?
Yes, please.
Yes.
Okay.
True or false, in keratoconus, Vogt stride disappear
True.
with external is correct. What is the inherence pattern of Leber congenital amaurosis?
Pass.
All right. Expand the retinal acronym PAMM.
Pass.
Apart from KOH, which stain is specifically used for diagnosing acanthamoeba keratitis?
Pass.
All right. And which nerve supplies the frontalis muscle?
Pass. In Leber congenital amaurosis, the mutation is autosomal. It is autosomal recessive inheritance.
Okay, on the buzzer, so I will take it. It is autosomal recessive. So we got the first 2 correct. PAM is paracentral acute middle maculopathy. Calcofluor white is used for acanthamoeba keratitis. I thought facial nerve is something we could have got. Remember, in facial nerve palsy, there is inability to raise the eyebrow on the affected side. So it's the facial nerve that affected by that controls the frontalis muscle. Well done, BMC 1.
So the next team is Team Retinets. Have you joined? Team 3?
Yes, ma'am.
Okay, great. So these are from AIMS, Raipur.
Excellent. Retinerds. Very imaginative names.
Yeah.
I like that Oro Serata went for set 6, which is also Oru in Tamil. Aru.
Oh,
All right. So Retinerds, which is your set?
Sir, set 6.
Ah,
set 6. Okay. So are you ready?
Yes, ma'am.
okay. True or false, inheritance pattern of congenital stationary night blindness is X-linked recessive.
True.
Okay. Next, inheritance pattern of Stickler syndrome
Autosomal recessive.
is incorrect. Expand PORN
Progressive outer retinal necrosis.
is correct. Which is the most common eyelid cancer in the Indian subcontinent?
Sebaceous carcinoma. Sebaceous gland.
Is correct. Which structure is abnormal in the axon field anomaly?
Iris. Trabecular. Iris.
Okay.
Okay, iris and trabecular network. I don't think we
Embryo.
were looking for an we were looking for an anteriorly displayed
sir.
Barthes
Yes,
line.
sir.
Yeah, so you got 4 correct. Sorry, 3 correct.
2 wrong.
4. Yes.
Correct. 2 wrong. So it's plus 20.
Yeah, so the first, third, and fourth they got correct. So with 2 wrong, it's plus 20 then. All right.
Thank you.
So at least in the positive team retinoids.
Yes, sir.
The next team is Team 6, that is Team Alpha from Sankara Eye Hospital, Coimbatore.
Team Alpha. Can choose your rapid fire set.
Set 1.
Okay. So shall we start?
Yes,
Yes.
sir.
True or false, intravitreal injections of chemotherapy can be used to treat retinoblastoma?
False.
is incorrect. What is the inheritance pattern of Stargardt's disease?
Autosomal dominant.
Is incorrect. Expand BPES. You better get this right now.
Expand BPS. Blepharophimosis. Blepharophimosis epicantha syndrome.
Is incorrect. Next question. Which xanthine-based dye is used to stain devitalized tissue on the ocular surface?
Pass.
Which layer is affected in central serous retinopathy?
Okay, time is up.
Right, time is up. So, intravitreal injections are used to treat retinoblastoma. It is autosomal recessive, not autosomal.
Epicanthus ptosis, epicanthus. Oh, inverses.
So you forgot ptosis and epicanthus inversus. Rose Bengal was what we were looking for. And in CSR, RPE is the layer that is affected. So I think they got BPES, I think 3 wrong.
4 wrong, sir.
2 wrong? Okay, 2 wrong.
The cheap power
4
was
wrong.
good.
Sir, 4 wrong.
No. So Rose Bengal and 4 and 5, they didn't answer.
4 they didn't answer. Okay, so 3 wrong, sir. Minus 50.
Yeah.
Okay. So the last team for this rapid fire round is Team 8, Team Theos from PMCH Patna.
All right.
They are actually stuck due to rains and no power. They said they'll join and call us, madam.
Okay. Take care. So we'll take there later on.
All right.
So with this, we end with the one set of MCQ, one set of rapid fire, and one case based. So it's time for second set of MCQ. So please refresh your Kahoot platforms. The first question in second set of MCQ is, the 30-year-old man with defective vision in left eye, all are correct except A. OCT shows elevated choroidal mass with overlying subretinal fluid and deposits. B. Fluorescein angiography shows early hypofluorescence and intense hyperfluorescence that persists in the late phase. C. ICGA shows washout phenomenon. And D. B scan shows dome-shaped mass with a smooth surface, hyperechoic signal of equal strength inside the mass. And the time starts now. So let's see what's the answer. It's B. In this case, the FFA will show early hypofluorescence and intense hyperfluorescence in the late phase. So this is a case of choroidal hemangioma. So now coming to the next question. Double circulation on FFA is seen in which tumor? A. Melanocytoma of disc, choroidal melanoma, choroidal osteoma, or retinoblastoma. And time starts now. So the correct answer is choroidal melanoma. I think today too much of oculoplasty and oncology in this semi-final.
Well, you chose the 2 quiz masters.
Yes. Now the third question. A patient with glaucoma developed this condition 3 weeks after a medication was started. So all are true for the images shown except it's seen with ROCK inhibitors. Fuchs endothelial corneal dystrophy is one of the risk factors. It usually presents in the interpalpebral or inferior cornea. Topical corticosteroids or hypertonic saline are the primary line of treatment in such cases. And the time starts now. So the correct answer is D. This is not a true statement. The topical steroids or hypertonic saline are not the primary line of treatment. The primary line of treatment is the discontinuation of the drug, and this is the reticular corneal epithelial edema, which is shown in the picture. The fourth question is, look at the pictures carefully on the left side. A 27-year-old lady with blurred vision 1 week after an episode of fever and rhinorrhea. Identify the wrong statement. Female preponderance is seen in such cases. It's usually bilateral multiple placoid lesions. On FFA, you will see early hypofluorescence and late hyperfluorescence. And it most commonly occurs in the second to fourth decade of the life. And time starts now. You need to identify the wrong statement out of these four. So let's see what's the answer. The answer is female preponderance. So it is actually acute posterior multifocal placoid pigment epitheliopathy, which is equally seen in male and females, and it is a type of white dot syndromes and is a self-limiting disease. The last question of this MCQ set is, identify the phakic IOL displayed in this image. Is it star ICL, IPCL, acrylic phakic IOL, or Apasami refractive implantable lens, that is RIL? And your time starts now. So the answer is, it is IPCL. So with this, we end with the second set of MCQs. And now it's time for a small commercial break. We thank His Highness team for the constant support throughout the season. So remember, friends, we have our final on 20th of May at the same time with new quiz masters. So please do log in on 20th of May at 7:30 p.m. So now it's time for again our case-based round. So Dr. Santosh sir?
Yeah. Which team are we calling?
Team 3, sir.
Okay.
Retiners from AIMS.
Arushi and Aisha.
Yes.
Yes, sir.
Can you choose the set, Arushi, Aisha?
Set 10, sir.
Set 10.
Okay.
Yeah. So this is a 48-year-old hyperthyroid male with bilateral proptosis, pain, redness, and diplopia in all positions of gaze. Okay, questions will follow. Question. Name 2 eyelid signs.
Del Rimple sign, Stelbach sign.
Next question. Name a pupil sign.
Pass, sir.
Next. What is the standard of care for the primary management of active thyroid disease?
IV meat and prednisolone.
All right. Answers. I think you got it really well, except the second question you did not answer. Eyelid signs are plenty: Joffrey's, Pochin, Rosenbach, Riesman, Enroth, Vigorous, Jelling, Gifford, and Boston. These are the signs. You can read up what each one of this means. And name pupil sign. There are 2 pupil sign, Neese sign and Cohen sign, one of which you could have said. And of course, the standard of care for active thyroid disease is intravenous methylprednisolone pulse therapy, which you rightly answered. So you get 20 points for this.
Yes.
Very nice.
Thank you.
So the next team is Team 4. BMC 1 from Bundelkhand Medical College, Sagar.
Team 4, Itisha and yeah. Which set?
Set 1.
Set 1.
Set 1.
Okay. 70-year-old lady with right lower eyelid deformity. You can see that now. What is the problem with the right lower eyelid? Right? Questions will follow. Diagnosis.
Entropion.
Okay. Name 3 mechanisms of pathogenesis of senile entropion of the lower eyelid.
Pass.
Next. Name 1 classic surgery.
Pentagon excision और horizontal for horizontal lid laxity के लिए tightening procedure.
Okay, fine. The diagnosis is, of course, lower eyelid entropion. 3 mechanisms is horizontal laxity, lower eyelid retractor, dehiscence or disinsertion, and overriding of preseptal orbicularis over pretarsal orbicularis. Classic surgery would be Jones procedure, Wheeler's procedure, or lateral tarsal strip. Lateral tarsal strip is also horizontal tightening, so you get partly correct. So we would give you 10 plus 5, 15 points for this.
Okay, sir. The next team is Team 6. Team Alpha from Sankara Eye Hospital, Coimbatore.
Hardi and Shardi. Yeah, go ahead. Which set?
Set 11.
Set 11. Okay. 20-year-old male with severe epiphora, no discharge for 3 years.
Okay.
Okay, questions will follow.
Jones test.
What is this test that has been done on
Jones
this?
test.
Next question. In lacrimal syringing, if there is immediate regurgitation of clear fluid from the opposite punctum with soft stop on probing, what is the diagnosis?
Canalicular block.
Which canalicular block?
Common canalicular.
Okay, no regurgitation, but the patient gets no fluid then.
No regurgitation. Which patient? No idea, sir.
No idea, sir. They passed them.
All right, that's pass. The test was fluorescein dye disappearance test. You got that wrong. Common canalicular block is correct. And when there is no regurgitation, but the patient gets no fluid, then perhaps there's an internal fistula. So you get 1 right and 1 wrong. That is
Plus 5.
plus 5.
The next team is Team 8. Have they joined? Sai?
Yeah, they're waiting, madam.
Okay. So Team 8. Team Theos from PMCH Patna.
Shambhavi and Simran.
Yes, ma'am.
Yeah.
Yes.
Choose your set, please.
Set 3.
Set 3.
Set 3. Okay.
Okay, so you see the patient's face. It's a 65-year-old male presenting with progressive bilateral severe ptosis for 3 years.
Severe progressive bilateral ptosis for 3 years.
Okay. Yeah, questions will follow. Which 2 tests can be done in the clinic to confirm myasthenia gravis?
Eye spec test and tensilon test.
Next question. Name a retinal feature of Kearns-Sayre syndrome.
Name a retinal feature of
Kearns-Sayre syndrome.
retinitis pigmentosa.
Okay, next question.
RP.
Which test is done to confirm CPO?
Which test is done to confirm CPAO? With एक सेकंड DNA mitochondrial unit test ragged fibers रहते हैं
Okay, all right. Okay. So can we have the answers?
हाँ muscle ragged fibers.
Fatigue test and eyes test. You said tensilon test is not a test that's done in the clinic. You know, so
Eyes
obviously you get plus 5 for it. Retinal feature, you get pigmentary retinopathy. That's correct. And which test is done to confirm CPO? Muscle biopsy for retract fibers. That's also correct. So you get 25 points.
Thank you, sir. Thank you.
So the last team for case-based round is Team 9. That is Team Netra from Chaitanya Eye Hospital, Trivandrum.
Anjana and yeah, so they are mentored by an oculoplasty specialist, so they should do well. All right. Choose your set.
The set number 2.
Set number 2.
Set number 2. Okay.
Right. Okay. Very classic 20-year-old girl with a congenital condition. And these 4 pictures show the clinical features. Have you seen the pictures well? Can we start the
Yes,
questions?
sir.
All right, questions. Complete diagnosis.
Monocular elevation
With
pass.
next question. Name one common clinical association.
Pass.
Next question. How do you measure ptosis accurately in such a case? Pass. All right. So it's congenital ptosis with monocular elevation deficits. So I can give that to you. One common clinical condition is Marcuscan jaw winking or any form of synkinesis. And how do you measure ptosis? Measuring MRD1 by having the hypotropic eye fix. Okay, so they get +10.
+10. Okay. So with this, we are over with the case-based round. So now it's time for rapid fire. So rapid fire. Team 1. The fovea finders from GMC Nagpur.
Yes, ma'am.
Okay. Which set?
Set 3.
Set 3.
All right.
Shall we start?
Yes, please. True or false, the traditionally recommended IOL formulas for short eyes is Hoffer Q.
True.
Is correct. The inheritance pattern of Best disease
Autosomal dominant.
is correct. Expand DUSN.
Pass.
All right. A Hollenhurst plaque is composed of what material?
Cholesterol.
Is correct. Fox pentagon, Crawford triangle, and double triangle are techniques of performing what surgery?
Ptosis correction.
Is correct. You have one. Expand DUSN. Okay, so the time saved you from saying a wrong answer at least. So you get positive marks. You got 4 out of 5 correct. DUSN is diffuse unilateral subacute neuroretinitis.
Okay,
Well done, fovea finders. Y'all.
Next team is Team 2, Binocular Bandits from Kasturba Medical College, Mangalore.
Okay, mentor is pediatric ophthalmologist.
Which set?
Set 7.
Set 7.
Set 7.
All right.
So, are you ready?
Yes.
Okay.
All right. True or false, in sympathetic ophthalmia, the exciting eye always has a worse prognosis.
Yes. Yes, sir. True.
It is incorrect. The inheritance pattern of choroideremia.
Pass.
Okay. Expand NSOID.
Pass.
Pass, sir.
All right. Which is the only FDA up to approved drug indicated for eyelash.
Prostaglandin, sir. Which I that verteporfin.
Is correct. You said number 4 answer was half. You want to expand on that?
Is it prostaglandin analog, sir?
Okay, so we'll give that to you. So they got one wrong, which is sympathetic ophthalmia. The exciting eye always has a worse prognosis. No, even the sympathizing eye can have a worse prognosis. You skipped second and third. I heard bimato and prostaglandin analog, so I'm going to combine that and give it to you. Vorteporfin is the photosensitizer for PDT. So
+15.
2 correct and 1 wrong.
Yes, +15 to them.
Well done, Binocular Bandits.
Next is team number 5, that is BMC3 from Bundelkhand Medical College, Sagar.
Adesh and Ajay.
Which set? Team BMC3?
9. Yeah. 10.
9 or 10? Ninth,
10.
we have already done.
I think they are locked down from 2 devices as an echo.
Hello. Say 10.
Okay. Shall we start?
Yeah,
Yeah.
let me just get my set 10 ready. Yeah. True or false, in thyroid eye disease, lateral rectus is most commonly involved?
False.
Is correct. Inheritance pattern of BPES?
Pass.
Expand MEWDS, mutes.
Multiple enhancement white dot syndrome.
Is correct. Which organism is most commonly implicated in canaliculitis?
Pass.
All right. Which billiards term is used to describe the entire anterior chamber filled with blood turning black or dark red?
Fourth का sir, Acanthamoeba israeli.
I heard acanthamoeba. That is incorrect. All right. So we'll have the answers. They got the first one correct. It is the inferior rectus which is most often involved. They passed BPES in spite of this being the 6th question on BPES in the quiz. In the previous MCQ round, Dr. Shilpi had shown a case of APMPP and mentioned mute, so they got that right. Actinomycetes is the most commonly implicated organism in canaliculitis, and I had acanthamoeba for number 5. So 5 is wrong, 4 was passed, 1 and 3 are what they got correct.
So plus 50.
All right.
Yeah. Okay. So we are remaining with the 2 teams now. 3 teams, sorry. Team 7.
Okay. Curiosity.
Curiosity from GMC Madurai.
All right. So what set have they chosen?
Set 11.
Set 11.
11, yes, ma'am.
Okay. Team 11.
Okay.
Mm.
We'll start.
Yes, sir.
True or false, most cases of CPEO are sporadic and not inherited.
False.
Is incorrect. Inheritance pattern of CHED.
Autosomal, CHED type 1 is autosomal dominant, type 2 is autosomal recessive.
Okay. Expand the acronym FLACS.
Femtolaser assisted cataract surgery.
Is correct. Which gene is associated with JOAG? Juvenile open angle glaucoma.
Pass.
Okay. Which eye drop recently got approval for mild ptosis?
Pass. Sir, shall I try fourth one?
The time is up. So they got the first one wrong, the second one correct, the third one correct, and passed the fourth and fifth.
So plus 15.
So oxymetazoline has recently got approval for mild ptosis. The ptosis gets corrected as long as the drop is effective. Once you stop putting the drop, after 6 hours, the ptosis goes away. But that doesn't mean you go out and buy your oxymetazoline nasal drops and put it. Eye drops are a different formulation.
Okay.
So the next team is Team 9 Netra from Chaitanya. They have done, sorry.
They're finished. Yeah.
Yes. Team 8.
All
Team
right.
Kiosk from PMCH Patna.
Yes, ma'am.
Yes. So which set you want?
Set 5.
Set 5. Okay.
All right. Okay. True or false, Haas exudates are composed primarily of calcium deposits seen due to vascular insult?
False.
Is correct. Inheritance pattern of Alport syndrome?
Alport syndrome तो वो वाला था ना यार सारा वाला रहता है इसका ऑटो ये X-linked dominant कहते हैं
XLD.
Is correct. Expand Azure, AZOOR.
Pass.
Okay. Which is the preferred dye for staining the ILM during macular surgery?
ILM ये ICG.
Is incorrect. What is the systemic drug of choice for eyelid capillary hemangiomas?
Okay, systemic drug for ये था उसने बताया था propranolol.
Okay, we'll give it to you. You started saying the answer during the time going out. So first one is, you got it correct. It is ardagurates are not calcium, it's lipoproteins. Alport syndrome is XLD, very well done. Azur was passed. ICG is not the preferred dye, it is brilliant blue. And in the nick of time, you all got propranolol in. So you get 3 correct and 1 wrong.
20.
Plus 25.
Thank you, sir.
All right.
So the last team to play rapid fire set is Team 10, Oro Sereta from Arvind Eye Hospital, Coimbatore.
All right.
Set 4.
The quiz masters team.
Shall we start?
Yes, please.
Okay.
True or false, the Marina trial investigated bevacizumab for ARMD?
False.
Is correct. Inheritance pattern of ocular albinism?
Autosomal recessive.
Is incorrect. Expand, dissect.
Decimate, stripping, automated endothelial
Is
keratoplasty.
correct. What muscle reserves innervation from the sympathetic nervous system responsible for retraction?
Mueller's.
Mueller's is
Mueller's
correct.
muscle.
What retinal lesion is seen in tuberous sclerosis?
Astrocytic hematoma.
Astrocytic hematoma in the nick of time. So they got the first one correct. It is not bevacizumab, it is ranibizumab. It was not autosomal recessive, it is X-linked recessive, but they got the other 3 correct. So 4 right and 1 wrong. Well done.
35. So yes, so we
Thank you,
are
sir. Team
over with all the sets of case-based, all sets of rapid fire and 2 rounds of MCQs. Now it's time for the last set of MCQs. So again, requesting everyone to please refresh your Kahoot platforms. So we are ready to start with the third round. The first question in the last set of MCQ is, according to the closed system of orbital disease analysis, the letter C stands for A. Compression, B. Clinical process, C. Conjunctival signs, D. Capsule characteristics. And the time starts now. So the correct answer is option B. C stands for clinical process in the closed system of orbital disease analysis. So it is structured clinical algorithm Jack Rootman uses for orbital diagnosis, that is clinical process, location, onset, signs and symptoms, and epidemiology. Coming to the next question. Necrobiotic xanthogranuloma involving the periorbital skin is classically associated with which systemic abnormality? A. It's related to IgA nephropathy, paraproteinemia, ANCA positive vasculitis, or sarcoidosis. And time starts now. So the correct answer is paraproteinemia. So it's periocular necrobiotic xanthogranuloma. It presents as a waxy yellow plaques with ulceration, and it is strongly linked to paraproteinemia, that is monoclonal gammopathy. The third question is, a salmon-colored flat conjunctival patch in the inferior fornix is most characteristic of conjunctival amyloidosis, lymphoproliferative disorder, that is lymphomas, Kaposi's sarcoma, or chronic chalazion. Time starts now. So the answer is B. This is mostly seen with lymphoproliferative disorders like lymphoma. The fourth question is epiblepharon natural course, which is correct. It's progressive worsening with age. Spontaneous resolution is seen by 3 years of age. Spontaneous resolution by 5 to 10 years of the age. And it requires an immediate surgical intervention. And the time starts now. So the natural cause of epiblepharon is the spontaneous resolution is seen by 5 to 10 years of the age. So it comprises of a horizontal redundant lid fold of skin and orbicularis in the lower lid, causing vertical orientation of the eyelashes. And it is commonly seen in the Mongolian features, and it usually resolves by 3 to 10 years of the age. And the treatment includes lubricants in the expectation of spontaneous resolution, while the surgical intervention is only required if cornea shows keratopathy. So now the last question of today's semifinals is, which of the following person has or have devised a classification for neovascular glaucoma? Keith Wagner, Vand, Weiss and Gold, Shees. And your time start now. Time is up. And the correct answer is it's Weiss and Gould who developed a classification for neovascular glaucoma. So with this, we end the today's quiz.
So thank you, Dr. Shilpi, for wonderfully taking us through this last round of MCQs, and all the quiz masters, Dr. Santosh and Dr. Akshay. So, Dr. Akshay, you can join us, get your video on. We'll have a small chat till the backend room is ready with the results for the private practitioner category. Meanwhile, we will have a small chat with all the team members who have logged in today, and with their mentors if they have logged in. So can I request all the mentors to just get their video audio on? We'll have a small chat, and we'll take some inputs from you how we can move ahead in future episodes as well, and what are the things that motivates your team and other things. Oh, well, Dr. Aparna, good evening and welcome. Thank you, Dr. Aparna, for being with us. You can get your audio video on, please.
Good evening, sir.
Good evening. And so you are representing Team Netra from Chaitanya Hospital. So what makes
sir.
you, what is that motivation for a mentor to be a mentor for this PG quizzes and all? What is it? You
Sir,
are
actually,
spending your
today's a
family
special
time.
moment for me.
Sorry, please go ahead.
Yeah, actually, it is a special moment. I was a participant. I was a participant 5 years back in the semi-finals, and that time I couldn't make it into the finals. But this time, I'm so excited to see my students in the same platform. That is very proud moment for me, and I'm also excited because my favorite people are there as a quiz masters. Uh, so it's a special moment for me.
Who is that? Dr. Santosh Honawar always. I know that.
She is an oculoplasty. She got gold medal in DNB in oculoplasty last year.
Okay. So
Yeah.
you have a small chat here. This is a family hour for most of the people who are beyond studies and all, and now you are into teaching. That what is your motivation besides this quiz master as Dr. Honawar, that you are sparing your valuable time and stealing away time from your family for these quizzes and for your mentees, rather, I should say. What is that single motivation?
You're asking me.
No, Dr. Aparna. I know.
Sir, actually, like my students are very hardworking and very enthusiastic, and they are preparing very well. And I'm trying to join with them. And for me also, it is a learning experience. I'm trying to attend all the quizzes.
Great.
And I'm encouraging my students also to participate. I had I think from my institute about four teams reached up to the previous level, and for finals, two teams reached to the semi-final round.
Okay, great, great. Santosh sir, you should interact with one of your fans at least. Say hello to her.
Good evening, sir.
Really, hi. Nice that you're mentoring a nice, I mean, team. Your team actually did very well, but in oculoplasty, they floundered a bit.
Yeah, that was bit and unfortunate for them actually. That question was tough for them. They knew all the other answers, I think.
Great. Dr. Aparna, keep motivating your students, and I hope hope to see you again as a finalist, mentor of the finalist team. And we will be declaring the results very shortly. Till then, bye bye from our end. Can we speak now to a mentor from Cure Curiosity? It is from Government Hospital Madurai, Dr. Parvata Sundari ma'am. Uh, okay, before we chat with the mentor, these are the top 5 practitioners who have made it into for this today's episode, 5 prizes. So that is win, NA, she, Q, par. So do get your video on, just raise your hands. Sai will promote you and we can then have a chat with you. Can you now just stop sharing the screen? We will have a chat with the mentors now. Parvata Sundari ma'am, I'm so happy to see you every year. Get your audio on, ma'am, please. Audio. You're muted. You're muted, ma'am. Still muted, I believe, ma'am. You're muted. Get your audio on. We can't hear you, ma'am. Sai, can you help them out?
Yeah.
Just let them out. 1 minute. She's muted. Can you, ma'am, are you not able to unmute yourself? Her frame is frozen, I believe. We have other mentors with us. Meanwhile, Sai. Sai, can you hear me?
Just a moment, doctor.
I do see Dr. Minal Vevare, who happens to be the mentor of Fovea Finder. You can get your video on, Dr. Minal. Hmm? So I think one of our mentor quiz masters have to leave a bit early. So Akshay, thank you once more. No issues, no issues. Well, we are just at the fag end of it. We just interact with few of the participants, as well as we thank all the mentors who are mentoring the teams who have reached up to the stage of semifinals. So thank you once more, Akshay, and we hope to see you again in next season again.
And hopefully this time next time it will not be sir and me, because then I mean, I love to be on the same platform as sir, but the students get an overdose of oculoplasty then.
No, it's not that. One thing is for sure, with Santosh Onavar there, he dawns upon everyone and he can really make life impossible for anyone. That is also equally true. Being a mentor, we have to accept. No issues. Thank you, Akshay, once more.
Bye-bye, sir. Thanks.
Thank you. Thank you. Dr. Parvata ma'am, can you hear us? You are muted, ma'am. No, we can't hear you. You have to get yourself unmuted. Dr. Santosh sir, Dr. Parvata ma'am's team, every season there is one team from her, and I really I'm really have no words to thank her. I don't know how she motivates, but every time from a government college, we are seeing many a times, if you see the bias in or the number of teams which are participating, government colleges somehow lack that type of a I don't know, motivation to some extent or whatever, I don't know. This is one team from Government Medical College, Madurai, which we see in every season. And that's why I was so keen to chat with her. What makes her so, we would have expected you to also to chat with Parvata ma'am, but unfortunately we can't do that because she's
GMC Madurai is a well, entrenched medical college. I think there are a lot of academics as well. And it's always important to have a good mentor. Otherwise, postgraduates are not aware of all these programs and they don't know how to prepare, and mentorship actually helps a lot.
exactly. Great. Thank you, ma'am. But I think you can log out and try once more. We would definitely love to chat with you, ma'am. We are also as excited and as eager to chat with you. You can log out and try once more, please. Till then, we will have a small chat with Dr. Meenal. Do I see you there, Dr. Meenal?
Yeah, Meenal is here.
Meenal, can you unmute yourself? Oh no. She is a professor at Nagpur Government Medical College. So yesterday she was with us for a FAT examination in our institute. So we'll like to continue our conversation with her. Dr. Meenal, get your video on.
Yes, sir. Can you hear me?
Yes.
Good evening, sir.
Can you hear me now, sir?
Yeah, Parvata ma'am, finally. So,
So how are you,
Santosh,
sir?
Thank you once more,
Thank
ma'am,
you.
for getting your team with us and enrolling your students every year after year. Santosh sir, you can have a small chat with such a motivating mentor.
No, I was just wondering how you motivate your students to participate in.
So actually, I think
Also
the
train
motivation
them
comes from the students, sir. Actually,
Okay.
it's their interest. Actually,
Mhm.
they were also so keen, and I think their motivation is our motivation. The better they are, I think the mentors will be even better.
And do you have any
What-
routine to train them?
Yes, sir. We do have clinical discussions and journal clubs and everything, sir. We have everything, and we also have all these programs going on. Everything we conduct quizzes for UGs, PGs. It's a routine, sir. Here we have 18 PGs in a college every year, so it's actually like a small college. We have enough PGs. So competitive attitude within these people, they actually they want to come out and make themselves better and. They're really proud, sir, when they attend such quizzes, and these people they've come up to the semi-finals. We're also very happy.
Yeah.
And I think too many of oculoplastic questions, sir. And if they had watched all your videos, they would have definitely answered everything. I think all the
Simple
eye
questions.
focus and
Anyway,
everything.
they did
Yes,
well.
sir.
They did well.
Yes, sir.
And really nice. Congratulations. We
Thank you, sir.
thank them
Thank
so
you.
much.
All India Ophthalmological Society PG program, as well as we have Santosh sir conducting Guru Sangam. How does it impact the students in your colleges there?
So sure, sir. It's very good. Actually, now I think most of the PGs they don't look at the textbooks at all. I think they were almost gone to watching videos, and almost everything is there. Of course, but they shouldn't ever forget the to read textbooks. That is the best. But still, I think it's like a ready reckoner.
Okay.
Immediately we can go back. Whatever we want, we are able to now say in iFocus or in AOS, something somewhere it is there always, and very nicely explained also. Really very good, sir.
Thank you, ma'am. We hope to
Thank you,
see you
sir.
next season as well as your team in the finals. We will be
Sure,
letting
sir. Sure,
you
sir.
sharing the results with the postgraduates in a coming 2 days. They will be knowing the results. Thank you once
Thank
more
you so much, sir.
for
Thank you.
encouraging us by your participation. Yeah,
Sure,
can I
sir.
have a
Thank you,
chat
sir.
with Dr. Meenal now? Meenal, can you join us?
Yes, sir.
Your video, I can't see you.
Sir, video is not getting on, but audio you can hear me.
Yes. So Meenal was with us for a DNB FAT examination. So I had quite a long chat with you. You can have a chat with a mentor like Santosh who is seated over there. Meenal, if you have anything to ask for him, he's there for you now.
Sir, I have heard Santosh sir's eye focus refraction lectures, so it helped me a lot. And the platform is very good for the PGs. And I am so proud that I have motivated 2 teams from GMC to participate. Both the teams have reached quarterfinal, and one team is into semi-final now. So that's a great thing. And you people are creating a very good platform for PG students. And looking at this only, I have started. Every month I'm conducting a quiz for PGs on topics from right from cornea up to retina. So that is also helping me to motivate the PG students. The chance which I have not got, I want my PGs to get that. So thank you, everyone.
No, that's a great sentiment actually. What you didn't get, you're making sure that your PGs get it. So that's great.
Yes, and thank you so much, sir, for creating that platform on iFocus. It's helping me, and I am recommending for every PG. So if they have any doubt, please go and watch iFocus lectures. They are very self-explanatory and it's very good for the PGs. So thank you so much, sir, for that. It's even helping me after a long journey.
Thank you.
Great, great. Thank you once more, Meenal, for being with us.
Thank you,
And
sir.
we can have now other, I think we have private practitioner category people. Dr. Jay Prasad, sir, Dr. Shahana, can you just get your video on? As well as Win, I can see you. You can get your video on. These are the people from a private practitioner categories who regularly participate in our quizzes, and they grab away a lot much money every episode per episode. And one amongst them, a habitual money maker, is this man. He's addicted to us. Vinith.
And Jayaprakash also is a habitual.
So, Dr. Vinith, क्या
Hi,
बोलते
sir.
हैं
Hello.
भाई?
How are you?
You have a mentor like a quiz master like who is such a tall figure like Dr. Santosh Honavar. You can ask anything to him now.
Agree.
And he will
Matlab, sir.
grant you any wish. Bolo.
No, nothing as such. Matlab, sir has always been an inspiration, a role model for all of us. Like,
Good, good. So very good, very well played, विनीत. अभी आपसे हमारे पास जो कोटा था बात करने का वो खत्म होते गया क्योंकि आपने पिछले 12-13 एपिसोड में हर बार पैसा हमसे लेके गए हैं. बैक में ऐसा लगने लगा है कि भाई कुछ अपन ने अभी किक बैक रखना चाहिए सिस्टम में. Okay, congratulations, Vinith. We'll
Thank
see
you.
you again in the finals as a finalist.
Sure, sir. Yes, sure, sir.
Jayaprasad, sir, we would definitely love to chat with you. Please.
Please
And
refuse to join, Doctor.
Refuse to join.
Okay, and Shahana?
She also refused.
Okay, no issues. So we had a wonderful semi-final 2. We had a good time. We had a good learning. And we had 2 oculoplastic mentor who really had and I know there must have been an overdose of oculoplastic questions for all the postgraduates, but be it. Very well played, all the postgraduates, and I'm sure we will be meeting again 2 weeks later. So that is going to be 20th May. We will be sharing with you on the various groups the results or the top 10 people who are going to make it into the finals. Till then, it's bye from our end. Thank you, Santosh sir, as usual. I don't have words to express my gratitude for being a part of our quiz and making quiz so much coveted that people, mentors, see to it that they come across a big man called Santosh Honavar.
No, I thank you and Shilpi for the enthusiasm with which you do it year after year, Prashant. I think great job. Hats off to you.
And 90% is this, 10% I just
In
come.
whatever ratio that you can internally distribute, but 100% is brought across to all the postgraduates.
Thank you. Thank you, boss. Thank you. Thank you, Sai and Team Highness for being with us again. So postgraduates, let us meet again on 20th. 20th May at 7:30 p.m. for the finals. Till then, bye-bye from our end. Bye-bye. Bye-bye, boss.
Thank you, sir. Bye.